All right, we are Team 5. We are OpenHand for employers. So one of the big problems that employers are going to be facing they have faced is a high cost of healthcare. And part of the result of the One Big Beautiful Bill Act is that employers are expected to face the largest increase in healthcare costs in over 15 years, with potential plan costs going up by 9%. Estimates that benefit costs can also go up. And this is based on survey data from multiple employers, with a lot of suggestions that they should invest in tools to help address this. And some of those drivers of cost that are increasing the health benefit costs in addition to the bill are specific components. And one that we're going to hone in on is the pharmacy, the medication cost. And as one of the other teams pointed out, there's a lot of variability in costs, and people are going to different places to try to optimize drug costs. And the way that can happen, from an employer perspective, there are approaches that are a bit more top-down, but the approach that we're really taking is more of a bottom-up of how do you actually empower employees with AI to make more optimal choices around the cost of their care. And so OpenHand aligns employer savings with employee empowerment by putting AI at the point of care. So there's an employer dashboard component to it and an employee AI sidekick. And a lot of tools that are out there, there are other tools that are employer dashboards that are trying to save costs, but they often work sort of after the point of care. And the core differentiator for us, where we think patient-centric AI fits into this model, is that at the point of care, when you are a patient talking to your doctor, making decisions about what kind of medication you might choose, how can we surface information that makes more cost-effective decisions happen there? And so with that, I also want to mention we really think through this trust element to make sure that as you have employer tools facing employees, that trust is also managed and maintained. And we'll talk more about that, but it's woven throughout our system. I'm going to pass it over to Rahul to go through the demo.
All right, please join me in praying to our demo gods and making sure that this works. Okay, so this is what you'd see as an employer. Imagine I am a chief people officer or an HR benefits manager. My company is about 50,000 people, so pretty large. And this is what you'd see as an OpenHand user. You'd see a dashboard of all of your cost centers across different areas of care. The one we're going to hone in on today is metabolic health. Primarily, we did some analysis and prediction for GLP-1 drug users. And so at a high level, you can see the cost spending across all of these areas, and then a heat map of where the factors of cost could come into play for all these categories. So you can see choosing a pharmacy really influences the cost of metabolic care for my employees, followed by lifestyle coaching and nutrition. So I'll click into here for a deep dive, and you can see the categories I had mentioned: pharmacy choice, lifestyle coaching, and nutrition. And we used Arlo's data set to de-identify and aggregate a bunch of data across 50,000 employees, 5,000 of which use GLP-1 drugs, and ran inference to predict ways we can save patients money by helping them navigate to cheaper cost medications. So this is powered by some real data over here, and you can see that if you slide this slider, you can start to forecast the monthly and annual spend, or monthly and annual savings across your employee base for the more people that use OpenHand to influence their decisions. And so we'll show you what the patient experience looks like in a second, but across other areas like lifestyle coaching or nutrition, you can imagine OpenHand can suggest wraparound services such as Omada Health or Season Health to try to address those cost centers as well. So now I'm an employee. This is a demo of a part of the flow that we're building as a consumer app, separate from OpenHand, or separate from this employer dashboard. But part of this flow is a real-time ambient patient scribe. So imagine I'm at a telehealth appointment with my doctor. I get consent from the doctor, and just like a meeting listening app, I click Start Listening. And while I'm having my conversation with my doctor, notes start to pop up about everything we're talking about. And then there's a trigger point during which the doctor starts prescribing medication, where we pull in information across nearby pharmacies, their costs, apply your insurance, and then suggest the lowest cost option. So in this case, CVS is my best place to go. So as a patient, I would select this, and then that would populate up and aggregate back to this dashboard where you can see actual savings versus missed opportunities. Let me pop it back to the slide deck.
Yeah, so I was the one writing weird symbols on the whiteboard, actually. And so on the surface, it looks a little bit like we just put a bunch of numbers on a dashboard. There's a lot of mentions of vibe coding recently. But what we actually did is we brought it back to first principles, where a lot of these AI systems work a lot better when you really focus on the modeling. So big shout out to Arlo for a bunch of data. But what we did was, simplified down, was we built a graph, and it's specifically a bipartite graph of all the different transaction data and claims data. And then what we did was we took that, combined with GoodRx price data. We did a pretty cool join of the different data with a pathfinding algorithm through the graph to figure out the lowest cost alternative for each patient. And the really fun part about this is that you can visualize things like this. And the way that it works is that you have, on the left side, that's one member, so one person who's making a claim for a GLP-1 medication. And what it's kind of like showing that the member is connected to their current drug that they're taking, which is connected to all the drugs that they could be taking for potentially cheaper prices. And then when you explode this out to a full view picture of your whole org, you get really cool pattern analysis. And I wish I had more time to talk about it, but there's a lot of really cool math going on here with the weird symbols that I was writing, so feel free to talk to me about it. But this is all real cost data analysis that we did. Everything that you saw on the dashboard is rooted in some sort of piece of information. So yeah.
Thank you.